Are you wondering if you should get a knee massager for your knee pain, or maybe you haven't even heard of it, but you're just trying to figure out what to do about your knee pain? Well, this is the video for you. We're gonna go into detail on the pros and cons of this mechanism itself and the benefits of light therapy and what you can be doing for your knee pain. So I get people trying to sell me stuff all the time because I own a physical therapy practice. There's some stuff that works really well and some stuff that doesn't. What's cool about this mechanism in itself is it doesn't just have light therapy, but it also has this massager and heat therapy all in one. I'm gonna first share a story with you about how light therapy really helped one of my patients, and it opened up my eyes on how this stuff can actually work. So several years ago, there's some sales reps trying to sell me these different forms of light therapy. I wasn't even familiar with it, I didn't even know how it worked. And one of my buddies, who's a physician and a chiropractor, he had thrown out his back and it was really bad. He got an MRI done, these discs were bulging and they were causing all sorts of issues. He was having foot drop, he was having a hard time lifting up his toes. And ultimately, I told the sales rep, I said, okay, now's your time to shine. So come on in and let's treat my buddy and see what it does. And guys, at that moment, I instantly got sold on what light therapy can do. Now keep in mind, this is deep tissue laser therapy. It's not the same as this mechanism. But what ended up happening was after one treatment, his symptoms improved by 30%. It was miraculous. And I was totally sold on the idea of how light therapy can help. And so why is that relevant to this mechanism? Well, this isn't deep tissue laser therapy, but it does have low-level laser therapy and infrared light. It's going to help stimulate what we call as ATP production. Now, this is a big term, but it's good to understand on how it works because this thing isn't cheap. But what you're going to look at is what does the light therapy do and how does it benefit you with your knee pain? And what it does is it promotes something called photobiomodulation. And what we're doing is that light penetrates deep into the cells and it produces more ATP. And ATP is like fuel for a fire. Now, when you throw gas onto a fire, it's not necessarily a good thing because it causes an explosion. That's not what we're talking about with your knee pain. What we're talking about is when you put more ATP in an area where you've got knee pain, typically you've got some arthritis or you just got inflammation, different things causing your pain, that ATP is utilized to help regenerate your tissue and the structure of that joint. So when you have more ATP, you're gonna have a quicker recovery, and this helps facilitate that. And there's no supplement, there's no medication that can do that, it's just light that can do that. And it's particularly light provided by a laser or red light therapy, which I'm sure you've heard of. It's got a lot of great reviews on Amazon. It's got, at this point in time, it's got over 1,600 4-star reviews, and that says a lot for a mechanism like this. So the massage or the vibration along with the heat is going to help expedite blood flow and stimulate a quicker recovery. It's also kind of soothing and it feels good. So if you're in a lot of pain and you're just trying to find some relief, that's what's going to help you. Do I believe in this mechanism and that it can help you with your knee pain? Absolutely. They're pricey, so it's an investment, but ultimately at the end of the day, if you're going and seeing a bunch of different physicians and spending all this time trying to figure out what to do, it could be worth your while. Now, what it's not going to do is it's not going to solve the long-term cause of your pain. And so if I was in your shoes, would I be looking into doing rehab and looking at different ways to take pressure off my knee joint besides just putting this on my knee once a day for 10 to 20 minutes? Absolutely. I'm biased. Now, I've got my own knee rehab course online. I would do that first because that's going to give you long-term results, and it's going to be something that you're not just putting a Band-Aid and trying to soothe your pain. It's actually going to keep it from coming back. Now, if you have the resources, I would buy both this and do the online course because they're both going to facilitate you having a quicker recovery. All the stretches and exercises on this day-to-day program that I have for you that's 30 days long, it shows you exactly what you need to do to fix your knee pain. It still can't produce more ATP in your joint. This thing can. And so I think doing a combination of both could be really advantageous for you and your knee recovery. Guys, if this video was helpful for you, please hit the like button below and share any comments or questions you have, and we'll talk to you soon.